The number of cases and hospitalizations remain high, and I know our health workers are tired. We have hospitals that are approaching their limit of COVID patients. We need to protect our health system and our health workers. I think of them when I ask myself if we can allow gatherings for Christmas. We're not going in the right direction. We're giving ourselves until December the 11th to make a decision. But if hospitalizations continue to increase, it will be difficult to take that risk. We must continue all our efforts. We still have difficult months ahead of us before the vaccine. The virus is very strong, and we see that everywhere in the world. I know there are a lot of people doing Christmas shopping these days, and I know it's important for our economy, but we'll announce new rules for malls and big stores in the coming days, and we ask the customers to be very careful. Of course, we still can't visit other people in their houses. We have to stay careful, especially with vulnerable people. If you have symptoms, get tested, please. And after that, stay home. COVID is dangerous. We can be very sick even if you're young and healthy. Please don't take any chances. If everyone does their part, we'll reduce contagion and we'll go back to a normal life with our friends and family. Thank you.
If Christmas was, say, in April, would that be a big relief to you? Is Christmas at like the wrong time because we see this second wave really taking off, and now all of a sudden we're really worried about having all of these gatherings at the end of December and that we're going to see an explosion of cases in January because of that? Can you give us a global portrait of what considerations you're taking in? Do you understand where I'm going with that question?
But first, it depends of how many people do we have, especially in our hospitals, all right? It's true that during Christmas time, some of the employees take vacations, so the offer of services is a bit less. It's like that every year. So it may have an impact on the results, but the main reason is that right now we see the number of hospitalization growing day after day. So we were at 500, we're now over 700. And we see that in some hospitals that we're getting close to the limit we've settled in these hospitals to receive COVID patients. So we have to look at that hospital per hospital in Quebec and see what's the situation. And we'll do that on December the 11th and then take the decision. But I want to be, I want to tell the truth to the population. Right now, the trend is not good. We see the number of hospitalization increasing. So I hope that it will decrease in the next 10 days.